Take 5 Health Literacy in 5 minutes or less. Welcome to Take 5 series Black History in Healthcare. Today we remember Lewis Tompkins Wright. Brought to you by Porcupine Coaching Center and Healthcare Access Alliance. Born in 1891, Lewis T. Wright became Harlem Hospital's first black surgical staff member and first black chief of surgery. He was also the first black fellow of the American College of Surgeons in 1934 and first black person to become a board-certified surgeon in 1939. Dr. Wright was the first black surgeon in the New York City Police Department and first to lead an experiment with aromycin, an antibiotic that was experimented on humans for treatment. Among other firsts, he was the first black physician to head a public interracial hospital. Born in LaGrange, Georgia, a doctor's son, Dr. Wright graduated from Clark University in Atlanta in 1911 and Harvard University Medical School in 1915, graduating fourth in his class. With lifelong perseverance for equal rights, he joined the NAACP in 1916, eventually serving as chairman for nearly 2 decades. Dr. Lewis Tompkins Wright was a surgeon, civil rights activist, and war hero. During World War I, he was commissioned as a first lieutenant in the United States Army's Medical Corps, running a field hospital in France and receiving the Purple Heart after a gas attack which permanently damaged his lungs. In 1919, he started a private practice in Harlem, becoming affiliated with Harlem Hospital. The New York Police Department appointed him police surgeon in 1929, a first for a black person, and Harlem Hospital made him chief of surgery in 1944, also a first for a black person. Dr. Wright achieved numerous firsts, the first black person to become a fellow of the American College of Surgeons in 1934, the first to become board-certified surgeon in 1939. He also founded the Harlem Hospital Cancer Research Foundation as one of the pioneers of chemotherapy, and in 1948, Dr. Wright was elected president of the hospital board, remaining through 1952. Dr. Lewis T. Wright was a surgeon, medical researcher, and NAACP chairman. He earned the NAACP Spenger Medal and published the Harlem Hospital Bulletin as well as several columns for the NAACP's magazine. He succumbed to effects of health conditions following service in World War I, and he died in 1952 at the age of 61. Harlem Hospital renamed its library after Dr. Lewis Tompkins Wright before his death. Take 5 Black History in Healthcare remembers Dr. Lewis Tompkins Wright, the first black physician to be appointed to the staff of a New York municipal hospital, the first black surgeon in the police department of New York City, the first black physician to experiment with aromycin antibiotic on humans, the first black surgeon to be admitted to the American College of Surgeons, and the first black physician to head a public interracial hospital. Tune in to the next video in the series Black History in Healthcare, remembering Marilyn Hughes Gaston. Lastly, like us on Facebook and subscribe on YouTube for notifications. Take 5.